Dozens of men tell me in clinic that something they did, a new habit, food, or hobby, seemed to make their pelvic pain, urinary urgency, or discomfort worse. Could everyday choices really be inflaming the prostate? If so, what should you stop doing today? Which common habits are supported by science as real triggers and which are myths? This article, written from the standpoint of a urologist and grounded in current, reputable sources, answers those questions in plain language so you can make safer choices and know when to seek medical care. Prostatitis and prostate inflammation are umbrella terms that describe several different problems, not a single disease. Some forms are caused by bacteria and respond to antibiotics. Others are non-infectious and may be linked to pelvic floor tension, nerve sensitivity, or chronic inflammation without a clear germ. The U.S. National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, and major urology resources divide prostate inflammation into categories such as acute bacterial prostatitis, chronic bacterial prostatitis, chronic pelvic pain syndrome, sometimes called chronic prostatitis, and asymptomatic inflammatory prostatitis, each with different causes, symptoms, and treatments. Because the condition is heterogeneous, the phrase, "you are inflaming your prostate," can mean different things in different men. For example, acute bacterial prostatitis often presents suddenly with fever, severe pain, and urinary problems and generally requires prompt antibiotic treatment. Chronic pelvic pain syndrome, CP-CPPS, the most common long-term form, may not involve a detectable infection at all and instead reflects a complex interplay of muscular, neurologic, and inflammatory factors. Recognizing which pattern fits your symptoms is the first step to safe, effective care. So, which everyday behaviors and exposures are most often linked to worsening prostate inflammation or symptoms? Research and clinical guidance consistently identify a handful of likely contributors: infections and urinary tract bacteria, certain dietary irritants, sustained perineal or pelvic pressure, most commonly from cycling or prolonged sitting, smoking and poor general health, and pelvic floor muscle tension caused by stress or overuse. These are not guaranteed causes for every man, but they are common, modifiable contributors that deserve attention. Bacterial infections are a clearly defined cause of prostate inflammation in acute and chronic bacterial prostatitis. When bacteria travel up the urethra or come from the bloodstream, they can seed the prostate and cause classic signs of infection: fever, chills, severe pelvic pain, difficulty urinating, and sometimes blood in the urine. In these cases, medical evaluation and antibiotics are the standard of care because untreated bacterial prostatitis can lead to serious complications. If your symptoms are sudden, marked, or accompanied by fever, seek medical attention promptly. Beyond bacteria, many men with chronic pelvic pain or intermittent prostate symptoms have a non-bacterial condition in which inflammation, nerve sensitization, and pelvic floor dysfunction are the dominant features. This means the prostate area becomes a focus of pain and irritability even without an active infection. The American Urological Association, AUA, emphasizes a broad, multimodal approach for these men that may include medications, pelvic floor physical therapy, behavioral strategies, and other non-pharmacologic tactics because no single therapy reliably cures all cases. The heterogeneity of CP-CPPS is why individualized care, often guided by an experienced urologist or pelvic pain specialist, is crucial. Dietary and fluid choices commonly affect symptoms because the prostate sits right under the bladder and any bladder irritant can be perceived as pelvic or prostate discomfort. Clinical sources and patient-facing guides repeatedly point to caffeine, alcohol, and spicy or highly acidic foods as common triggers that can worsen urgency, frequency, and pelvic pain. Highly processed foods, refined sugars, and pro-inflammatory dietary patterns appear linked to systemic inflammation and may indirectly worsen prostate-related symptoms over time. Conversely, diets rich in whole foods, fruits, vegetables, oily fish, sources of omega-3 fatty acids, and adequate hydration tend to support general and urologic health. While diet is not a magic cure, sensible dietary changes often reduce symptom severity in many men. Physical activities or postures that place prolonged pressure on the perineum and pelvic floor are another important category. Long periods of sitting at a desk, in a car, or on a bicycle saddle, increase local pressure and can aggravate pelvic structures. Research and clinical reports have documented associations between extended, intensive cycling and increased urogenital symptoms in some men. Saddle design, posture, and ride duration all matter. That doesn't mean cycling must be avoided entirely, but men experiencing pelvic pain or urinary symptoms should consider seat modifications, shorter rides, frequent breaks, or alternative exercise forms until symptoms improve. Similarly, heavy lifting or activities that strain the pelvic floor can provoke symptoms in susceptible men. Stress, anxiety, and the resulting pelvic floor muscle tension are frequently overlooked but powerful contributors. Chronic stress increases muscle tone and sympathetic nervous system activation. The pelvic floor muscles, like any other muscle group, can become tight and painful. In men with CP/CPPS, pelvic floor dysfunction, characterized by high resting tone or poor relaxation of pelvic muscles, is commonly found and responds well in many cases to targeted pelvic floor physical therapy, trigger point release, and relaxation training. Addressing stress through behavioral strategies, mindfulness, and targeted therapy is frequently part of a successful plan. Many men also ask whether sexual habits, masturbation, or masturbation frequency inflame the prostate. The medical answer is nuanced. Normal sexual activity is not harmful for most men, and ejaculation has not been shown to cause long-term prostate inflammation. However, very prolonged or rough sexual activity or activity that involves repeated trauma to the perineum could theoretically exacerbate local tenderness in a man already prone to pelvic floor dysfunction. The safe approach is moderation and attention to any activity that makes symptoms worse. If something clearly aggravates pain, scale it back and discuss it with your clinician. Keep in mind that men with acute bacterial infection should avoid sexual activity until treated, and any unusual symptoms should prompt medical review. Patient resources like Mayo Clinic and similar organizations provide patient-focused guidance on this topic. Medications and medical conditions can also play a role. Some drugs, for example certain antihypertensives, antidepressants, or diuretics, may alter urinary patterns, sexual function, or nerve signaling in ways that indirectly aggravate pelvic symptoms. Metabolic conditions such as diabetes and cardiovascular disease increase the risk of infection, reduce blood flow, and chronic inflammation, and they are associated with worse lower urinary tract symptoms overall. If symptoms begin after starting a new medication, discuss the temporal relationship with your physician. In many cases, an alternative drug or dose adjustment can help. Given the range of triggers, what practical steps can a man take immediately to reduce the chance he is inflaming his prostate? Start with conservative, low-risk measures that target common irritants and mechanical stressors. Reduce or avoid caffeine and alcohol for several weeks to see if urgency or pelvic pain improves. Cut back on spicy and acidic foods if they provoke bladder discomfort. Improve hydration with water rather than sugar-sweetened or highly caffeinated beverages. If you cycle frequently, review your saddle and bike fit. A more ergonomic saddle that reduces perineal pressure, standing breaks every 20 to 30 minutes, or alternating with lower impact exercise can be helpful. Stand up, move, and stretch regularly if you have a sedentary job, and consider pelvic floor relaxation exercises and breathing techniques to reduce muscular tension. These simple changes will not cure every cause, but they are often the first meaningful step toward symptom relief. If conservative measures are insufficient, medical treatments vary depending on the underlying cause and may be combined in a multimodal plan. For suspected bacterial prostatitis, antibiotics remain the cornerstone of therapy. Acute cases need prompt antibiotic treatment and sometimes hospitalization if severe. For chronic non-bacterial pelvic pain, urologic guidelines and reviews recommend a combination approach that may include alpha blockers to relax urinary tract muscles, non-steroidal anti-inflammatory drugs for short-term pain control, pelvic floor physical therapy for muscular dysfunction, behavioral strategies, and in select cases, medications directed at neuropathic pain. Long-term or repeated antibiotic use without clear evidence of infection is discouraged. The AWA and other authorities emphasize individualized treatment and often refer patients to multidisciplinary pelvic pain programs when single therapies fail. Pelvic floor physical therapy deserves specific mention because many men with CP/CPPS have long-standing pelvic muscle dysfunction that responds well to skilled therapy. A trained pelvic floor physiotherapist can teach relaxation techniques, manual release of trigger points, biofeedback, and tailored home exercises that reduce resting pelvic tone, improve coordination, and diminish pain. Studies and clinical experience show that, for many men, addressing the musculoskeletal component is a turning point in recovery. If you have persistent pelvic pain or suspect pelvic floor tension, ask your clinician for a referral to a pelvic floor physical therapist experienced with male pelvic pain. What about supplements, herbal remedies, or prostate support products? The evidence is mixed and often limited. Some men report symptom relief from products like saw palmetto or certain anti-inflammatory supplements, but clinical trials have produced inconsistent results and regulatory quality varies widely among over-the-counter products. Because supplements can interact with medications and rarely come with reliable dosing or purity guarantees, discuss any supplement use with your doctor and favor evidence-backed, regulated treatments when possible. Broadly speaking, adopting an anti-inflammatory diet and improving cardiovascular fitness will deliver clearer, safer benefits than unproven supplements over the long term. It is also important to recognize red flags that require immediate medical attention. Fever, chills, worsening pain, difficulty urinating or inability to pass urine, blood in the urine, or systemic symptoms suggest a possible bacterial infection or other urgent problem and should prompt same-day medical evaluation. Acute bacterial prostatitis can be severe and occasionally life-threatening if untreated. In contrast, slowly evolving pelvic pain without fever is more likely to be chronic non-bacterial prostatitis or pelvic floor dysfunction. This is rarely a medical emergency but does require thoughtful, often multidisciplinary care. Prevention and long-term strategy are centered on general health measures that reduce inflammation systemically and reduce mechanical stresses locally. Maintain a healthy weight, exercise regularly, favoring low-impact aerobic exercise when pelvic symptoms limit high-impact activity, stop smoking, control blood sugar and blood pressure, and eat a whole foods-based diet rich in fruits, vegetables, whole grains, lean protein, and omega-3 fats. These measures lower the baseline inflammatory burden on the body and improve circulation and healing capacity, which in turn support urologic health. Additionally, ergonomic adjustments at work and while exercising, including regular breaks from sitting, careful bike fit, and attention to posture, will reduce local strain on the pelvic floor and prostate area. Many patients also benefit from education and reassurance. Worry and misinformation increase stress and muscle tension, worsening symptoms in a self-perpetuating cycle. Learning that pelvic pain syndromes are common, often non-life-threatening, and frequently treatable even if they require patience and multiple approaches can be deeply relieving. Structured behavioral interventions such as paced voiding, bladder retraining, relaxation practices, and cognitive behavioral therapy, when appropriate, can reduce symptom intensity and improve coping. Team-based care that includes urologists, pelvic physical therapists, pain specialists, and mental health professionals offers the best chance of durable improvement for men with complex or long-standing symptoms. Finally, clear communication with your healthcare provider matters. If you suspect prostate inflammation, describe your symptoms precisely: onset, pattern, any associated fever or chills, urine changes, sexual symptoms, recent bike riding or pelvic trauma, new medications, and what makes symptoms better or worse. This information helps clinicians choose the right tests, such as urinalysis, urine culture, or targeted imaging, and avoid unnecessary or prolonged treatments. Never hide sexual or pelvic symptoms out of embarrassment. Urologists and other clinicians see these complaints frequently and will help you find rational, evidence-based options. In short, many everyday choices can influence prostate and pelvic health, and some common activities do increase the risk of irritation or symptom flares. Bacterial infection requires prompt medical attention and antibiotics. Dietary irritants, prolonged perineal pressure, for example, from cycling or extended sitting, pelvic floor muscle tension, and systemic health conditions are common, modifiable contributors for chronic symptoms. The best strategy is a pragmatic one: reduce obvious irritants, address mechanical and muscular contributors, optimize general health, and seek individualized medical evaluation when symptoms are persistent, severe, or accompanied by systemic signs. Evidence-based guidelines from major urology organizations and clinical centers support a multimodal, patient-centered approach because prostate inflammation is rarely explained by a single simple cause. If you have concerns about prostate inflammation or pelvic pain, discuss them with your primary care doctor or a urologist who can help sort bacterial from non-bacterial causes and design a safe, stepwise plan. Immediate care is warranted for fevers, severe pain, inability to urinate, or rapidly worsening symptoms. For ongoing discomfort, targeted pelvic physical therapy, modest lifestyle and dietary changes, and expert guidance frequently restore function and reduce pain over time. The good news is that while prostate and pelvic problems are common with aging and other health conditions, they are also usually manageable when approached thoughtfully and with current, evidence-based care.